Hey, Barney. I love you. First thing about this scenario, what information is of concern? Blood pressure, heart rate, respiratory rate, third-degree burns. How much? Pretty good amount. Both lower extremities, second-degree burns. I mean, without even calculating, pretty good amount. Now, we don't normally calculate first-degree burns, but where is the burn? Even though I don't calculate that, should that get your attention?
Yes.
Even though it doesn't say anything about soot, that needs to get your attention. Even if his voice is not hoarse, don't throw that out the window. Guys, I cannot tell you how quickly that will sneak up on you. And you're like, oh, they're fine. In 5 seconds, that airway will swell shut. So, and we're going to get to the lecture in just a second, but I'm telling you, if this swells shut, can I intubate now?
No.
If this swells shut, can I do a surgical crike?
No.
Where do I do a surgical crike? Right here. Guess what you just did? You signed their death warrant. What you gonna do? There's nothing you can do. If they're discharged to Jesus, that's what you just did. When you hear that stridor, when you see that soot in the mouth, you need to intubate them and put them on mechanical ventilation immediately. You know how much a hair trigger, boom, right there. That's how much a hair trigger you need to have. And if you are in the emergency room, heaven forbid, oh, we're gonna bring that patient up to the med. No, you ain't. They're going to the ICU. They're going back to the ER. You grab that bed and drag them right back down to the ER. No, right on my back. We're going right back down to the ER. They have got to be intubated, and if you can get a 2.5 tube down, and that's it. Guess what size we're going to get? A 2.5 tube. That airway will swell around that tube. If that's all you can get, that's what you can get. 5 days from now, when the swelling goes down, we will replace that tube with a bigger one. I cannot emphasize that enough. Did I turn that on? Okay. All right. We do not calculate first-degree burns. Does that mean they don't hurt? Who's had a bad sunburn in here? And that makes me grouchy AF. For all of us that have Irish in us, we get burned up. Now, has anybody in here ever heard that African Americans cannot get sunburned? How much of a lie is that? I don't care how much melanin the African American, and it's not just African Americans, anybody of Iranian descent, and even some Mexicans have so much melanin in their system, they can get just as sunburned as we can. It just takes a lot longer, and it's just as painful. How much? How much? So, both lower extremities. And how much is this? Both lower extremities? 18. Right and left arm. Both upper extremities. How much? 18. How much? 36. Everybody agree?
Yes.
No, it's only on the front though.
It didn't say, but we're going to go ahead and say that it's both. You're right. It's anterior and posterior on both legs. That's right. So both legs times 2. So we're at 54 and 18. Wait. I'm sorry. Y'all know I can't do math. We're at 36, 18, 54. Guys, how much are your legs? On the front. 9 on the front. 9 on the back. What if you only burn on the top part of your leg? 4.5. See, y'all so good. Last time I said this, the class was like, okay, that just blow y'all mind, didn't it? So here's your arm. How much is the front of your arm?
5.
So your whole arm is what? 9. The front? The back. Very good. How much is your head? How much is an adult's head?
4.5.
Children have little fat heads. They do. In relation to their, you don't need to know, kids. So, for adults, left arm 9, right arm 9. Y'all are right. Head 9. So, front of the head, 4.5. Back of the head, 4.5. Chest, 9. Abdomen, 9. Collectively, the front, 18. The whole back, 18. Left leg, 18. Right leg, 18. Your groin, just 1. Guys, I put this chart on there on D2L. There is another one that's in the PowerPoint. It just depends on which one you like. All right, let's do the same thing on this one. This one has got some things of concern that aren't really listed, that you kind of have to figure out. What does it say happened to him? He was trapped. What happened to him, though? Why was he trapped? Bing fell on his leg, trapped him in the house for an hour, and it was on fire. His temp is 101, pulse is, respirations. He is conscious, but he's hurting. No singed nasal hairs. He is breathing spontaneously. Second-degree burns, anterior chest, abdomen, entire left leg. How much TBSA? Does everybody agree? How much anterior chest? Whole, yep, whole chest. 18. Entire left leg. 18. How much? Everybody agree? What else? What scares me about this? There's two or three different things. Huh?
Internal burn, like the airway.
It doesn't say anything about singed airway, but it doesn't say anything about his voice. What happened to him? A beam fell on his leg. Leads to compartment syndrome. That will kill you dead. He is moaning in pain. What'd you say, Daryl? Smoke inhalation. Somebody else said it. Cyanide. Guys, 80% of the time, it's not the fire that kills you. It's whatever's burning in the house. Whatever's burning makes toxic chemicals. Cyanide, and what's the other one? Carbon monoxide. That's what kills you. He has been exposed to both. Anytime anybody is in a enclosed compartment, house, room, building, whatever, and they come into the emergency room, you need to find out how long they've been in there, and you need to do a very thorough assessment. What does a pulse ox monitor? What number does it give you? Speak up, I'm old. Absolutely not. Hemoglobin saturation. Is it saturated with oxygen? No. It can be saturated with poop. It's whatever it's saturated with. Carbon monoxide has a 200% greater affinity for hemoglobin than oxygen does. They'll be looking at you and your O2 sat will be reading 100 and they're dying in front of you. You have to have this patient comes in my emergency room, I have a very high index that he is toxic levels, carbon monoxide poisoning. A lot of places that I have trouble pronouncing this, carboxyhemoglobin level is a send out. Is 2 days later adequate for this patient? No. There is a drug that they can give them. Evidently it is very, very expensive because at Vanderbilt, the charge nurse had to go get it and it was under lock and key. It was pretty cool looking. It was in this glass bottle and it was, it looked like red wine. You always need to be highly suspicious of patients just because they don't look like they're injured.
Somebody call now!
I know that's a lot. This is a no-brainer. Hey, what does burns affect? Primarily. What are the functions of your skin? It does. How does it offer protection? It is what? First line of defense. What else? How does it regulate your temperature? What else? It keeps all your fluids in there. If you ain't got your skin, what happens? All your water leaks out, right? We don't want that. What are the layers? Epidermis, dermis, subcute, fascia, bone. All these are vital for this lecture and understanding the depth of the burn. Y'all know we gotta talk about pathophysiology. Guys, this goes to the cellular level. Used to, we had 5,000 different kinds of shock. Burn shock, it is a thing, but at the end of the day, it's kind of a distributive shock that results in a profound hypovolemic shock. It's kind of a combined thing. It's not classified under any of them. I think it gets under the hypovolemic shock umbrella. So you've got the burn insult. Here we go. There's an inflammatory response. What gets released? Histamines, cytokines. What do they do? What effect do they have to the capillaries? What starts happening? Fluid starts going where? Into the tissues. Third spacing, right? What starts happening into the third spacing in the peripheral? Edema. So you see edema everywhere it's not supposed to be. Your fluid starts going everywhere it's not supposed to be. Where's your volume? Outside of the vessels. You've got hypovolemia. Now, all your volume's out in the tissues. You don't have any skin. You don't have anything to keep it from escaping. You've got hypovolemia on top of hypovolemia. That's why there is a profound hypovolemic loss, a profound cardiac output decrease, and a profound hypotension, right? You don't have any volume coming back to your pump, correct? You can't pump out what you don't have. Why do I have hyponatremia? What's going out with the fluid? The salt. Now, why do I have hyperkalemia? What's happening to the muscle cells? When they're burned, they die, right? When the cells die, what do they release? Massive amounts of potassium. Guys, this is not slow. It goes from 0 to hyperkalemia immediately, like a level of 8. Your heart will stop. What is this? It goes up. If you didn't hear her, she said your H&H goes up. Why? Where's your water? It's either in your tissues or where? On the floor. Because you've got third-degree burns over 80% of your body. Your skin is gone. So all your water leaked out. So what's left in your tissue, in your vessels? Your red blood cells are just floating around with no water. So what is your H&H? Ooh, I'm doing great. My crit is great. Oh, no, you're not. It's like if you were dehydrated as hell, right? Because that's exactly what this is. What do you think your BUN and creatinine would be? Through the roof. Because you are basically dehydrated. You have no volume. All you got left is stuff. Except for your sodium, because it went out with the water. I've got hypovolemia. On top of hypovolemia. Now, my H&H is high. My BUN and creatinine is high. Where's all that stuff going to lodge? Hypoperfusion is going to cause what in the kidneys? An acute kidney injury. And, what'd you say? Failure. What's that going to do to cardiac output? It's going to decrease and decrease until it what? Stops. Oh, and I've got hyperkalemia. So you're going to go into VFib. Guys, burn injuries, if they are back, even if you've got like a 25% third degree burn, that is a severe injury. How does this affect us as nurses? I ain't even talking about wound care. How does this affect us psychologically? Has anybody in here seen a bad burn? How did it affect you? Is it hard to look at?
Yeah, he set himself on fire, so his whole body was like charred.
You seen a bad burn, Jennifer? The smell. You can't get that smell off of you.
I think it was also like the crying or the screaming. That was kind of hard too.
Was it an adult?
Yeah, I had an adult pregnant woman working at Chipotle trying to reach something, and she
I had hey guys, I'm not trying to depress y'all. This is the world we live in. Let's throw some non-accidental trauma in there with the children that are put in the burning water or set on fire. Or the young lady that her boyfriend didn't like her anymore and he put her on a lit grill. Right, girl? There ain't enough guns in this world. Guys, that's hard for us to see and keep our, because what we want to do is, here's my ID, girl. Let me, 5 minutes, that's all I need. I got some succinylcholine in there and we gonna hook him up. That's what we want to do, but we can't. It's very hard for us psychologically, and it's very hard for them psychologically, because their life will never be the same. And if you work in the burn ICU, that is some of the sickest patients. It is minute to minute trying to keep them alive if they are that sick. Yes, ma'am.
How do you put Tom's laundry? Sorry.
Staples. She just asked, how do you put telemonitors?
You literally attach with the staple here?
How you gonna put an IV? They put a cut down.
If their back isn't burned, can you put them on?
You can.
On their back?
You try your best to put it on unburned skin. But and the worst burn I've ever seen was 90% third-degree burn. We'll talk about that. So when you intubate somebody, what do you have to put around that? What you gonna tape it to? Y'all seen them? What are they secure with, right? And tape. What you gonna tape it to? These are all things that will have to be thought about when these burn patients come in. Guys, what is all this basically? Shock. There's a few extra things thrown in there. I mean, this is not the sodium-potassium pump that fails. It is instant hyperkalemia from muscle death. But it's shock at the end of the day. Death. You remember we talked about in acute kidney injury, and I told y'all I was going to put a strip on here? The strip is on the next page. Guys, it's going to be on your test. I've already told you that. I don't need you to know these numbers. I need you to know what this looks like. This is where the sodium goes in, potassium comes out, the cell dies. Tall peak T waves. Does that look like a STEMI? It does not. It does not look anything like that rounded tombstone. Remember we talked about the J point? This is the isoelectric line. Guys, there's a J point. It's not elevated. It's peaked. Now, here, there's P wave. What happened? It's gone. What is happening here? It's getting wider. What's a normal, and you don't have to memorize this, but what's a normal potassium? Does anybody know? 3.5 to 5.5. So that's not really elevated that much. Now, 6.5 to 8. Whiting. 8, greater than 8. Wasn't this clinical group? There was that. Didn't we have that guy's potassium that was 9.2 down in the corner? Yeah, that's one of the highest I've ever seen. And he was sitting there talking to us, and I was like, damn, we need to do something. You sure that's accurate? His QRS was really wide. this is called? Guys, this is bad. We did give him some calcium, but we gave him all the things. This needs calcium. Quickly. Calcium gluconate fixes this really quick. And they come back to a, if it's not a normal sinus, it's really close to a normal sinus. You have got to give them calcium gluconate. If you leave them in this, it's going to be V-fib and dead. Sine wave, V-fib, asystole. And let me tell you, if they get here, you're not going to get them back. I've never seen anybody that has progressed to this stage that comes, even with electricity. Why do you think so? Because you let them get too far and their heart is dead because of the potassium. Do you see what I'm telling you? Here's the isoelectric line. That's the J point. With that STEMI, the J point was up here and it was elevated. This is a tall peak T wave. It is an obvious difference. Guys, I'm not going to try to trick you on this. You are going to see that and you're going to be like, oh, that's that. How do you know if a burn is bad, worse, or the terrible, awful? Have y'all seen that movie? Y'all even know what I'm talking about? Can I help? Oh, come on. Terrible, awful. Y'all know I'm from Mississippi, right? See, that explains a lot, don't it? I actually had worked down in Tunica, Sugar Ditch. It ain't Sugar Ditch no more. It's one of the most profitable places. There ain't nothing down there but rice fields and casinos. What are the types of burns? Types. Chemical, thermal, electric, and radiation. Depth. First, second, third, and fourth. I'm trying to think what year that was. They changed the terminology. I'm going to put both, but they're getting away from first, second, third, and fourth. You will see partial thickness, full thickness, and superficial thickness. I'm sure by this point you guys have heard of ACLS, Advanced Cardiac Life-Saving Skills. There is a ABLS, Advanced Burn Life-Saving Skills. The only time you probably would ever take it is if you work on the burn unit. Total body surface area. Does location matter? It does. What do I mean by complications?
Infection.
What about your health? Period. What else? Say it louder. How old are you, sir? She's 36, I'm 51. We get the exact same burn. Who's gonna fare better? She is. She's in better health than I am, and she's younger. Guys, that's just the way it goes. What if a 9-month-old and she gets burned? She's gonna fare better. That 9-month-old will not fare well with that burn. They don't have the capacity to get over that. Not yet. The very young and the very old do not do well with anything. And I can't remember. There was a surgeon that was, he got involved in all the burns that were up there, and he gave me a formula like age in years, percent in body surface, mortality, and it was struck scaring me with how accurate it was, but I don't remember what it was. Y'all tell me what these are. Types of burns. Chemical. Radiation. Be careful. It's two. It's chemical and thermal. It's a chemical plant, so you're gonna have what? Chemicals there, and it has exploded, and it's on fire. Why is that electrical? Does anybody know what current that carries? How much? Y'all guess.
10,000.
800. 850.
6 to 800. It will kilt you dead.
Yeah.
They've had several people that have committed suicide that way.
What was the answer?
It's between 6 and 800. But I really didn't know where that third rail was, so I had to look it up. That's actually where it is. Chemical. Thermal. Electrical. Chemical. Radiation. Here again, thermal, chemical, electrical, and radiation. Which one of these do we not deal with very often? Radiation. How do we get radiation burns? Sun, X-ray, heaven forbid, nuclear weapon. What's the one other place that we can get exposure? Oncology. Like if you work in oncology, you can definitely get exposure from some of the medications. Did somebody say something? Each type of burn has factors about it that can make it worse. I know this sounds stupid, but hot can get hotter. How hot can steam get? Does anybody know? 1,200 degrees. There have been, where do you think we would get a steam exposure? Cooks. And where do you think those are? In the face. Where do you think it's gonna go? In the airway. Are you gonna see soot? No. What are you gonna hear? Bad stridor. Horse. Can't breathe. Power plants, chemical plants. Why did I put this? Water heater, if it's exploded, or somebody's fixing the water heaters. Why did I put this? Heat does rise. It's 100 degrees down here, 600 degrees up here. That's why we teach our kids what? Stop, drop, and roll, yes. How do you get out of the house? Crawl. Where does the smoke go? Up. How long? What'd you say?
So I did not know that I'm moving right.
Crawl. And I'm going to show you something in a minute that tells you again why you should crawl. how long was whatever that was burning in contact with your skin? That's why we teach you stop, drop, and roll. You know, Miss Sutton asked me a question earlier because I showed her my shirt. Do they teach kids that anymore? Do we teach stop, drop, and roll? I was like, girl, they taught us that like every week. Stop, drop, and roll. Throw a blanket on, like the blanket gonna catch on fire. So, the thermal burn, it depends on how deep. First, second, third, fourth. The severity is total body surface. Is it 10, 20, 30, 40, 50, heaven forbid, 60, 70, 80% of total body surface that is affected? Where on the body is burned? Yes, ma'am.
Will we have to calculate total body surface, or will that be given to us?
You will have to calculate it. NCLEX is not going to give you that chart. So I am not giving it to you. Guys, you're not going to have to calculate the Parkland formula. I looked on several different websites because I was trying to make sure that, and all of them said that they didn't have that on there. So if y'all have a question about that, please don't come back and beat me. But all of them said that TBSA was on there. Yes, ma'am. No, I'm only gonna ask you guys about adult. But I am telling you right now, you will have at least one question that you have to figure out TBSA. Because it is on NCLEX, I'm going to ask you about it. Besides airway, what about location is important? Why your hands? What else about your hands is important? What if I say the word functionality? What do you use your hands for? Everything. Your job? Are you a nurse anymore? Probably not. Or you might be a teacher, but I wouldn't be able to teach anymore, right? As much as I use my hands. What else with functionality? Right, I'd be up here. I want a hook. I'm gonna stab somebody. What else as far as functionality? What other location?
Feet.
Feet?
The 1%.
Huh?
And the 1% carry.
And your 1%. What functionality is that? Children? Bowel bladder? What else does that affect besides functionality? Your psychological. Because now, not only the function of having children, but the psychological effect of never being able to have children. Right? Where does Maslow's fit in? A, B, C, D, E, S. Guys, I'm serious. And you can say it ain't a base need if you want to, but you lying. I mean, yes, it is belonging and intimacy, but it's down there too. We said your feet, right? Can you imagine having a 3rd-degree burn on your feet and trying to walk? What other areas that are functional? Yes, ma'am.
So I've heard from a burn nurse that if your head gets like burned like too hot, your skull can melt. Is that, you know, because I heard that from like the burn ICU. Like there were little kids in the back of the truck, and there were paint fumes, and it caught on fire, and the kids were like melted to heat, and their brain melted, and their skull melted.
Now I know your brain can,
Maybe it like went into their skull.
but that. You know, I always hesitate to tell you guys things, right? That patient was dead, but I don't know about the bones, but your brain can do that. What else functionally that you use every day? Yes, ma'am.
Joints.
Joints. So not just the initial insult. What do burns cause?
Infection.
Inflammation, infection, on down the line. Scars. What do scars cause? Tightening and contractures. Might not affect functionality at first. On down the line, if you don't go to PT and OT, even with extensive physical therapy, you still might have those contractures. They might have to have surgery to release those tendons. Here again, these can be complicating factors on any of these burns. Here's what we talked about before. They call these the toxic twins. Carbon monoxide, hydrogen cyanide. Guys, this was a long time ago when I was 35. I was part of the volunteer fire department. Back then, all of the couch cushions and your sofas and little chairs were made out of this foam. And when they caught on fire, guess what they emitted? Cyanide. They have pretty much started making them out of a different substance, but guess what all the old ones is made out of? They're still around, and when they catch on fire, they put off cyanide. That's what killed people. And carbon monoxide, anything we do about carbon monoxide is just going to be there in the smoke. We've already talked about carbon monoxide, 200% greater affinity for hemoglobin. It goes and it just knocks oxygen off there. How do we get that back? You give them what? Oxygen, 15-liter, non-rebreather. The little thing is pegged out at the little oxygen tree and it's quivering. Here's a question, can smoke burn? Can it?
Yes.
Everybody's got to commit. Yes?
Yes.
Hands.
Yes.
No. Yes or no?
Yes.
There's your couch cushions. They're on fire. This is a controlled burn. Watch the ceiling. There's your smoke. This is why you crawl. This is called a flashover. The ceiling is on fire. Everything in the room catches on fire. 1,500 degrees. Do you know how much temperature a firefighter's turnouts can take?
Nowhere close to that.
600 degrees for 4 minutes. And they start catching on fire. This is why we crawl. Duly noted. Just because it's a house fire. Just like that. So, in an enclosed space, there's no oxygen in there, right? The flame goes out and it smolders, and all that carbon monoxide builds up. What happens when you introduce oxygen? It is an explosion. Now, what happens if I walk in and there's an explosion? What happens to me? I get yeeted. Now what kind of injury do I have? A whole lot of broken bones, and I'm burned. Do you see these? That fire's rolling. You're gonna watch it suck back up in there. There it goes. And now watch. There you go. It's called a backdraft. Fire is so dangerous, and there are so many things that can happen. What does everybody in here that has a garage have in your garage? Gas, paint, kerosene, the birdie salon with your nail polish and the hairspray, anything explosive and catches fire and is dangerous, the meth lab, the fentanyl.
Anything that can be set on fire.
Is there?
Set on
Yes.
fire. If it isn't set on fire, it is now.
What are the special factors about chemical fires?
Byproducts of that reaction.
Water makes it worse, you get off.
What is important about which?
What to use to put it out. Some chemicals will just make it worse. And healing specific volumes just to put out.
How do I know what to put on it?
The color of the flame.
Yeah.
If I look it up on the MSDS, how do I know what to put on it?
You gotta know what burns.
Huh?
You have to know like what substance it is.
What type of chemical? There's only two main chem types. Respiratory, acidosis, or alcohol. They're either an acid or a base. Which one would you rather get burned with? An acid. Bases are hard to deal with. Acid you flush out with water. Bases are bad to deal with. They get on your skin and they just keep burning. Acids you can neutralize. Bases are, you don't just throw acid on them to neutralize. So with chemicals, it matters what kind. It matters like whether it's hydrochloric acid or a citric acid. How much of an exposure was it? Was it this much or was it this much? What sort of penetrating ability does it have? The location, as in, did you inhale it? Was it on your skin? Or was it an enclosed space? All these things matter. What matters with electrical?
How much?
Definitely the voltage. Has anybody in here ever been shocked, like really shocked? How much did you get?
I didn't personally, but I had a friend who was a lineman, and he got shocked, and you could literally see the entry and exit point, and they had to. He was bad off for a little bit, but he's okay now.
Did you see the entry and exit?
I saw pictures of it. I didn't personally see it, but
Was it very impressive?
it was pretty cool looking. I'm not gonna lie. But
What did you touch that you got
The
shocked?
plug, and then it exploded, and then I also passed out.
Guys, high voltage is nothing to play with. I was 2 or 3 softball fields over, thank God. It did not strike the person, it struck the ground. And it knocked everybody on the softball field down. It didn't kill anybody. I don't know how it didn't kill anybody. I don't even know what it struck. It scared everybody to death. But I will never forget that. I don't even know how many volts a lightning bolt is. It's in the thousands. It definitely matters, voltage. What does path mean? Path of the body. What's the worst one? If I reach up here and my foot's on the ground and it goes right down my heart, what's the miraculous thing about the cells in your heart? They have their own what? Electrical current. How long? Because that electrical current, you have to be what? It blew you off of it. If it's a high enough current, can you let it go? You cannot. And it will hold you onto it until what? You catch on fire. What does this mean? Huh? What you say? The environment.
Like, are you taking
If you wet, why does that matter? It conducts. Why is that important to us? Yeah. If somebody's wet and you're going to defibrillate them, you're going to get shot. You're going to hear this word, and it might be important. What is the iceberg effect?
On the surface, it looks good.
It looks great. It's just a little iceberg on the Titanic. It's not going to cause a lot of damage. Oh, Lord. We're sinking. Did you hear something? Oh, look, there's snowflakes. Sometimes when I was working in the burn, I said, you usually see a little black mark on here and a little black mark on their foot. Everything in between point A and point B was fried. Doesn't look so bad on the surface. This is what you see. This is what's underneath. I mean, honestly, that is what killed the Titanic, is what was underneath the surface. Because it damages everything that goes from the electricity. What is my foot in that case? It's the ground. Some of the things that save the electrician is what do they have in their pocket? Pliers. That's where it goes to ground. It depends on where they touch the electricity and where the ground is. Have y'all ever heard, oh, if it's lightning, you're safe in your car? Because you have, that's, I'm not going to say it's a lie.
You're safe at this highly conductive object.
Well, it's not a lie. I was on the ambulance, they called us out. This guy's car got struck by lightning. And there was a car pulled over, and the car pulled over, and he was in this beautiful black Dodge Ram. You see how much of an impression this made on me. And this lady, she comes around and she said, I saw it. He got shot. No. The lightning struck his front grill. And so I go running up there, and y'all know the smell that electricity that's burning has, is that ozone. And I snatch the door open, and his smoke rolls out. His dash is dripping. And he's sitting there looking at the dash. He's in shock. I was like, Mister, you okay? Like, I saw the innards of his car. The plastic is dripping. I said, sir, are you okay? He looked at me. He said, I think lightning just hit my car. I said, I think it did too. I could not believe he was not hurt, guys. Everything that could melt in his car was melted. I was like, let's get you out of the car. It didn't hurt him, but it scared the crap out of both of us. I just could not believe that his car was ruined. But she told me, the lightning hit his front grill. put him in the back of the ambulance and kept him back there for an hour checking him out. I was like, I could not, I was like, you sure there's nothing wrong? No, not her. Are you sure? I'm sure. There's got to be something wrong with you.
So everything's dissipating, like, every single wire of that blood.
I don't know how he didn't wreck, because there was the river down there. I would have driven off in the river and never been seen again. With electrical burn, this is a big thing. What is this? This is muscle death. And it starts releasing this toxin. And so your body goes into what? Rhabdomyolysis. What is your first hint that you're going into that? Your urine looks like what? Looks like Coke, kind of like red wine, tea-colored. If you have a burn patient and you walk in and you see that and it hadn't been like that, you better do something. You're gonna up their fluids.
The typical household burn.
Guys, I'm trying to decide where we stop. Oh, this is the one I put on here. I'll put the other one on here as well. Whole front, whole back, 9%, 9%. Did y'all hear, or I don't know if I said it, about the Palmer method? So when we're doing this, do you think we overestimate or underestimate? We overestimate. Why is that a bad thing?
Fluid resuscitation.
Y'all heard me talk about the Parkland formula? Why do you think it's bad if we give them too much? Too much fluid. Yeah, you put them in fluid overload. They've already got fluid going out into the tissues. So if there's third spacing, where else is that fluid going? Into the lungs. If it's a small burn, what do we use? The Palmer method. Is it your palm? No, it's their palm. This is Lyme, guys. His palm is a lot bigger than mine. Size matters. Now, when we were first doing the IV fluids, I so wanted that IV catheter thing, and with size matters, but I figured that was pushing it for even me. So, if it's just literally his palm, that's 0.5. If it's his entire hand, palm and fingers, it's 1%. So if it's just right here, that's 1%. If it's right here and right here, it's 2%. But that's only for a very small burn. And we only count what kind of burns. Second and third degree burns. I know first degree burns suck, but we don't count them when we come to major burns. I think we're gonna stop here. I do want to show you this. Superficial thickness, guys, this is not hard to understand. It's called the first degree. Partial thickness, second degree. Full thickness, third degree. Deep full thickness is a fourth degree. What is this? Bones, tendons. What is this usually? Dead. You don't usually get this kind of burn and be alive. A lot of times electrical burns can be this bad. A lot of times electrical burns, if they're this bad, can cause fractures with the electrical current. Thermal burns, chemical burns, and things like that don't cause fractures, but when the electrical current is that strong, it goes through there and it breaks the bone. Any questions about what we talked about today? I will post the groups online on D2L now that I corrected all the duplicates. I sent out that simulation homework, guys. It's just like I said in the beginning. You get out of this what you put into it. You ain't got to download it anywhere, but you come to simulation and you haven't looked at it, you're not going to know what's going on. You also need to look in EHR charts to get the information for what we're going to talk about. Does anybody know what this simulation is? It is a COVID patient, but somebody said it. This is a terminal wean. This is Mr. Juan Ramirez. This is the third and final for him. Guys, this is a hard one, but it's necessary because it's not just COVID, but it's going to happen. And I want to remind you, this is a safe place. I would rather do this here with us than this happen your first day that you're in the hospital. I'm not saying that we're the end all be all, but I hope that you know that this is a safe place. And if you're going to fall apart, I mean, I've fell apart several times this clinical, and it'll happen every time, but I would rather you do it here with us and feel safe than to have it your first day of orientation. So just look at the stuff in EHR chart. I don't remember the other two. I think it's an acute kidney injury and chest tube. I might have it backwards. All right, I'll see y'all this afternoon. Yes, ma'am.
I have a question about ETI.
Yes.
The 2023,
Yeah.